Hello and welcome to the September 2017 issue of BGS British Journal of Surgery Editor podcast. I am Julio Mayol, Professor of Surgery at Universidad Complutense, Chief Medical Officer at Hospital Clínico San Carlos in Madrid, Spain, and Council Member of the BGS Society. It is a month of exciting and major changes at BGS, including an initiative that will increase our global reach and improve interaction with surgeons wherever they are. But first, the September issue of BGS, including my paper of the month. Most surgeons are familiar with randomized trials. They are a standard method for investigating the superiority of one surgical technique against another or establishing that new technology performs better than an established one. However, it is not unusual for a new treatment to have the same efficacy as an established treatment with lower cost and side effects. In this case, an inferiority trial design may be used. Our statistical editors explain all you need to know about inferiority trials in their statistical nugget corner. How many of your patients suffer chronic pain after surgery? You might be surprised to hear that 12% have moderate to severe pain 1 year post-op. Wild and colleagues from Bristol, UK, explore the evidence for a variety of interventions to reduce pain after surgery in a systematic review. This paper is essential reading for all surgeons. For some time, surgeons have explored a variety of interventions to improve patients' experience of surgery, including efforts to reduce length of stay. Few studies have examined the effects of sleep deprivation. In this issue of BGS, surgeons from Europe examined whether psychological support and sleep adjuvant measures reduce sleep deprivation in patients undergoing esophagectomy in a randomized clinical trial. In this issue, we have 3 papers for the esophageal surgeons, including biomarkers for survival of patients with adenocarcinoma, the changing trends of esophageal surgery and outcomes between 2004 and 2013, and the utility of imaging in predicting esophageal conduit necrosis. Surgeons tend to think they know everything there is to know about appendicitis, but every so often there comes along a trial or a paper that challenges perceived wisdom. The APAC randomized trial of appendectomy versus antibiotic therapy for uncomplicated appendicitis was, perhaps, one such trial. In this issue, the authors of the APAC trial present the economic argument, which may surprise some of you. National and international guidelines recommend long-term follow-up after bariatric surgery. Do you know the long-term outcomes in your patients? Did you follow them up? A national cohort from France provides a useful real-world data yardstick for outcomes and suggests that, in France at least, surgeons aren't following guidance. My paper of the month for September 2017 is the Scandiv randomized clinical trial of laparoscopic lavage versus primary resection for acute perforated diverticulitis 1 year outcomes. After reading the short-term outcomes report, given that acute diverticulitis may recur, a legitimate question remained. What is the best therapeutic option for patients with Henry 3 diverticulitis in the long run? The answer is available now. If your patient is severely ill, we do not know. If your patient is not, a choice must be made. More stomas for resection versus more sepsis, early reintervention, or recurrent diverticulitis for laparoscopic lavage. Oh, wait, don't forget early postoperative colonoscopy following lavage. And now to our major announcement. BGS has recognized the important role social media plays in the presentation and consumption of surgical publishing, and we are therefore delighted to announce the appointment of Mr. Richard Brady as social media editor. Many of you will know Richard both as a consultant colorectal surgeon in the UK and as a pioneer in the development and use of social media in surgery. Richard will be an integral part of the editorial team. Expect to see a rapid transformation in the coming months. And finally, congratulations to Professor Derek Alderson, former Editor-in-Chief BGS and now Editor-in-Chief BGS Open. Derek has commenced his 3-year tenure as President of the Royal College of Surgeons of England. I am sure you will all join me in congratulating him and wishing him every success.